Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. If you are a senior who lives alone, be careful of your dietary vitamin intake. Older adults in the UK who are socially isolated are more likely to have an insufficient intake of key micronutrients such as vitamin C and vitamin B6, increasing their risk of health problems, according to a new study led by University College London researchers. The study, published in the journal Age and Aging, looked at data from 3713 people in the UK aged 50 and over who filled in a detailed questionnaire about what they ate and drank on 2 separate days. The researchers found that people who were more socially isolated were more likely to have a lower than recommended intake of 5 micronutrients that are essential for health, that is magnesium, potassium, vitamin C, folate and vitamin B6. These micronutrients are typically found in small quantities in fruits, vegetables, legumes and fish, suggesting a diet lacking in these food sources. Lead author Professor Andrew Steptoe said, "Our study shows that people who are more socially isolated are less likely to be getting enough micronutrients in their diet. This is important as inadequate intake of these micronutrients puts people at greater risk of health problems as they get older." One explanation for this link is that if you are more isolated, you might not have others around you to provide information about what is healthy and encourage a more varied diet. Older people who tend to stick to diets they know and might not vary their foods as much as they used to. Obesity may be linked to 40% of postmenopausal hormone-positive breast cancer. Around 40% of postmenopausal hormone-positive breast cancer cases may be linked to excess body fat, suggests Spanish research published online in the Journal of Epidemiology and Community Health. This proportion is significantly higher than 1 in 10 such cases currently attributed to excess weight using the widely used measures of body mass index, and indicates that the real impact of obesity on breast cancer risk has likely been underestimated, says the researchers. BMI isn't necessarily a very accurate measure of body fat, particularly in older women, because it doesn't account for age, sex or ethnicity, they point out. They therefore compared BMI with the Kunbe, a validated measure of body fat that does account for age and sex, in 1033 white postmenopausal women with breast cancer and 1143 free of the disease, but matched for age, sex and geographical region. All the women were taking part in the multi-case controlled Spain study, which aims to evaluate the environmental and genetic factors associated with bowel, breast, stomach and prostate cancer and chronic lymphocytic leukemia among 20 to 85-year-olds. All participants were quizzed on potentially influential risk factors, that is socio-demographic lifestyle and personal or family medical and reproductive histories. Dietary information was collected through a validated semi-structured 140-item food frequency questionnaire, and a self-administered questionnaire was used to gather information on usual alcohol intake between the ages of 30 and 40. Obese women are at a higher risk of developing hypertension and cardiovascular diseases. Obesity is a widespread public health challenge in the Middle East, maintaining prevalence in 54.2% of women and 31.4% of men in this region. Overweight and obese women have a higher risk of hypertension and cardiovascular risk factors than women with a standard BMI, according to an analysis of the ANCOR's YW study presented at ACC Middle East 2024. The findings highlight the urgent need for targeted interventions that address socioeconomic determinants of health to reduce the cardiovascular risk burden in young Middle Eastern women. Young Middle Eastern women who are obese or overweight are facing a higher risk for the development of atherosclerotic cardiovascular disease and its associated risk factors like hypertension and type 2 diabetes, said Mohammad Adnan Bani Baker, MD, a medical doctor at Prince Hamza Hospital in Amman, Jordan. The researchers used data from the ANCOR's YW study to assess the prevalence of cardiovascular risk factors associated with being overweight among young Middle Eastern women. New therapeutic strategy identified for most aggressive and deadly type of breast cancer. Triple-negative breast cancer remains the most aggressive and deadly type of breast cancer, but new findings from cancer researchers at Brigham and Women's Hospital, a founding member of the Mass General Brigham healthcare system, are pointing the way towards therapeutic strategies that could be tested in clinical trials in the future. Using patient-derived samples in preclinical work, researchers discovered that by combining 2 therapeutic agents, they could nudge triple-negative breast cancer cells into a more treatable state. Findings were published in Nature. When combined, these therapeutic agents can hijack signals that occur naturally in the body to eliminate breast cancer after the cessation of lactation to kill these aggressive cancer cells, said senior author Karen Chikowski, PhD of the Division of Genetics at Brigham and Women's Hospital. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.